How does IVF really work? What every couple needs to know before starting. Hi, my friends. I know this moment carries a lot. And if you are here together, it means you are already walking a hard road, hand in hand. It's completely normal to feel unsure or even scared when someone says IVF, In Vitro Fertilization. I've seen so many couples just like you staying together in my office, holding on to hope, but also holding so many questions. What really happens during IVF? Will it work? Will it hurt? Are we even ready for this? And deep down, there is often another question you are afraid to say out loud. What if all the things we've heard are true? But that's exactly why we are having this conversation, to take the fear out of the unknown, to give you a clear, honest answer. Step by step, we will talk about what is IVF, why do so many couples delay IVF, the IVF process step by step, why personalization matters. Let's begin together, one step at a time. Please stay with me until the end of this video. I'll break down each step of the IVF process in simple and clear language. And I truly believe this knowledge can make your journey easier. If by the end you feel this video helped you, please share it and leave a comment below, because your voice, your story might be the exact thing someone else needs to hear today. I am Dr. Handan Namlı, an obstetrics, gynecology and fertility specialist. Over the past 27 years, I've helped more than 10,000 couples achieve their dream of parenthood. Every week, I share informative and easy to understand videos on YouTube to support your fertility journey. Don't forget to subscribe and turn on the notification. I'm sure you don't want to miss these valuable resources. Part 1. What is IVF? IVF stands for an in vitro fertilization. This simply means we help the egg and sperm meet outside the body in a lab. Then we place the fertilized egg, an embryo, into the woman's uterus, hoping it will grow into a healthy pregnancy. In a natural pregnancy, the egg and sperm must meet inside the fallopian tube. If fertilization happens, the embryo travels into the uterus, implants, and grows. But for some couples, something is in that process isn't working. Maybe ovulation isn't regular, or the fallopian tubes are blocked, or sperm count, motility, or quality is low. And maybe your ovarian reserve decrease, egg quality has declined. It doesn't mean you failed. It simply means we must use science to support nature, because your dream matters. IVF can help with all these problems. Part 2. Why do so many couples delay IVF? I completely understand why so many couples hesitate. You may have heard that IVF is painful, too long, or that it means using someone else's eggs or sperm. But there is the truth. Most of those fears come from old stories or misunderstandings. In the vast majority of IVF treatments, we use your own eggs and sperm. The embryo is completely yours. The injections are small. Most women give them at home themselves. And while it's not effortless, once you understand the process, it is far less scary than it seems from the outside. My goal is never to rush you, but I don't want to lose time either, especially if IVF is something that could bring you closer to the family you've been dreaming of. And the process, it takes a bit of effort, but it is not as painful or complex as people think. When you understand it step by step, it becomes much easier to manage. Part 3. The IVF process. Step by step, let me take you through the full journey. Step 1. Initial assessment. Getting to know you. Before starting any treatment, we begin with a consultation. This is where we sit down and carefully go through your medical history. We talk about your past treatments. Even if they didn't work, they still give us very valuable information about your body and how it responds. Things like previous surgeries, illnesses, or medication you use can all help us understand your situation better. These details helps us create treatment plan that's personalized just for you, not one-size-fits-all approach. Every part of your story matters, and we use it to build the best path forward with care, clarity, and your comfort in mind. Step 2. Ovarian stimulation, helping your body grow more eggs. Now let's talk about the part where we help your ovaries grow more eggs, because this is an important step. To do that, we use hormone medications, and we choose the exact protocol based on your body and your needs. Sometimes we start at the end of your previous cycle, or we might begin on day 2 or 3 of your period. You'll give yourself a small injection every day, always around the same time. I know injection can sound scary, but these are tiny needles. Most women do them at home on their own without trouble. We'll teach you how and be there if you need help. During this time, we'll invite you to the clinic a few times to check how your follicles are growing. Follicles are small sacs that contain an egg cell inside. We might also do some hormone tests to see how things are progressing. It helps us to guide the process safely and effectively. Once your follicles are ready, we schedule your egg collection. This whole stimulation phase usually lasts about 10 to 14 days. And you might feel a little moody or notice some bloating in your belly. That's totally normal, and it's temporary. If we don't transfer the embryo in this cycle, those feelings will fade. But if you do get pregnant after embryo transfer, those symptoms often turn into early pregnancy signs. Actually, I explained these signs more in another video. I'll leave the link for you in the description in case you want to watch that next. Step 3. Egg collection. What happens on egg collection day? Once your follicles have grown to the right size, it's time for egg collection, or what we call egg retrieval. It is a short and gentle procedure. We'll give you light sedation so you can rest through it. No pain, no stress. You'll just take a little nap. During the procedure, we go into each follicle and gently collect the follicular fluid and egg inside. Our embryologist checks the fluid under the microscope and tells us how many eggs we found. The whole thing takes about 15 to 20 minutes. You'll rest for about 1 to 2 hours afterwards in the clinic, and then you can go home same day. No need to stay overnight. Afterward, you may feel some light cramping, kind of light period pain. That's very normal and usually goes away quickly. If we are planning a fresh embryo transfer, we'll start you on progesterone to support the lining of your uterus and help with implantation. But sometimes we don't do that embryo transfer in the same cycle. This doesn't mean anything is wrong. It just means your body may need a little time to recover and rebalance before we transfer the embryo. In fact, in our clinic, we usually prefer to freeze embryos and then 1 to 2 cycles later do frozen embryo transfer. In that case, we'll wait for your next periods and then decide on the best timing together. Step 4. Fertilization, creating the embryos. After we collect your eggs, our embryologist begins the next important step, fertilization. There are 2 main ways we can do this. First, conventional IVF, where we place about 50,000 to 150,000 sperm around each egg and let fertilization happen naturally in the petri dishes. Second type, ICSI, which stands for intracytoplasmic sperm injection. In most cases, especially when sperm numbers or quality are low, we choose ICSI. With ICSI, we only need 1 good sperm and 1 healthy egg. Even if sperm is very limited, we can still create an embryo, and sometimes that embryo brings incredible hope. Step 5. Embryo culture and transfer. Once fertilization happens, we place the embryo in our incubator. We often call it a kind of artificial womb. It keeps the condition just right, and we carefully watch how your embryos grow day by day. If we are planning a fresh embryo transfer, the timing can vary. We might do the transfer on day 2, 3, 4, 5, 6, depend on your embryos and your body. Most often, we prefer to transfer on day 5 or 6. That's when the embryo reaches the blastocyst stage and has the highest chance of success. But sometimes we may transfer earlier, on day 2 or 3, if that's what's the best for you. And this is so important to remember. Every patient's needs are different. There is no one perfect day for everyone. What matters is choosing the right plan for you, and when we do that, success is much more likely. The embryo transfer procedure is painless procedure. You don't need anesthesia. We need a full bladder to see the endometrial lining perfectly under ultrasound guidance through the placement of the embryo into the uterus. You may follow the catheter that carries your embryo. It is a magical and emotionally sensitive moment. After a short rest in the clinic, you can go home. You can walk, you can climb stairs, and you can go to the restroom. You can continue your normal life, maybe a bit a slower pace. Step 6, the waiting period. What you need to know. After embryo transfer, the hardest part begins, the wait. During this time, you'll need to continue using your prescribed medication exactly as we discussed. They help support the uterus and give the embryo the best chance to implant. Now, I know many women wonder, should I stay in bed? Should I avoid moving too much? But actually, you don't need to stay home or do bed rest. You can go on with your daily life. Go to work, take a shower, do light chores, take a walk, or go for fresh air. Bed rest is not necessary, and in fact, it can reduce circulation, affects your digestion, and increase anxiety. I completely understand the fear. Many women tell me, I'm afraid I'll lose the embryo if I move too much. But please trust me. Once the embryo inside the uterus, it doesn't fall out. Your body knows how to hold it safely. If you need more reassurance, I've shared another video all about what happens after embryo transfer. I'll leave the link for you in the description. Please watch it. I think it will help calm your mind. Now, here's what happens next. About 8 to 12 days after transfer, we'll do a beta-HCG blood test to check for pregnancy. If it is positive, we repeat the test 48 hours later to see if the pregnancy hormone is rising properly. After that, we'll schedule your first ultrasound, usually around 1 week to 10 days later, to check for the gestational sac. We want to confirm an intrauterine pregnancy, and about 14 days after beta-HCG, we'll look for the fetal heartbeat. Every step is gentle and will guide you all the way. Part 4. Why personalization matters. IVF is not one-size-fits-all treatment. We personalize everything: medication protocols and doses, timing egg collection and embryo transfer, number of transferred embryo, transfer day, or additional treatments and procedure like genetic screening of the embryo. This personal touch makes IVF safer, more effective, and less stressful. If you are watching this and IVF is something you are considering, don't let fear or myths hold you back. You are not alone, and you don't have to do this blindly. Book a fertility consultation. Let's talk. We'll look at your unique case and guide you step by step with honesty, kindness, and care. If this video helped you, please give it a like, share it with someone who might need hope right now, and drop your thoughts and questions in the comments. Your story might help someone else feel less alone. And remember, every fertility journey is different, but you are not alone in yours, and your dream matters.